Hello, my name is Dr. Jeffrey Klein, inventor of Tumescent Local Anesthesia. I want to tell you today a little secret about tumescent anesthesia. It's called Detumescence. This has not been described very thoroughly in the literature. It's something that everybody, at least the dermatologists who use this technique, know about. Surgeons who don't use tumescent anesthesia totally by local anesthesia, in other words, if they use general anesthesia, are not aware of detumescence. Detumescence is the process by which fluid under the skin, after tumescent local anesthesia, this fluid dissipates. This is the process of fluid dissipation after tumescent local anesthesia. It's important because providing enough fluid to create tumescence under the skin, swelling and firmness of the tissues because of the large volume of fluid. This large volume is necessary to achieve good vasoconstriction and excellent complete local anesthesia. However, during a surgical procedure, it's much more efficient if a lot of this fluid has dissipated. So after we do tumescent infiltration, totally for liposuction, totally by local anesthesia, we wait a number of minutes, usually a half hour to an hour sometimes, for this fluid to dissipate. And the local anesthetic and the vasoconstriction last for 8 to 10 hours after the infiltration. But by waiting these minutes for detumescence to occur, the fluid has largely spread laterally, and the targeted tissues are less tumescent, and this makes the surgery much easier to accomplish. For example, with the liposuction, if we do not wait for detumescence to occur and start liposuction immediately after tumescent infiltration, then the majority of the fluid that comes out is slightly blood-tinged anesthetic solution, and perhaps only 20% of the fluid aspirated is fat. However, if we're doing an abdomen and we wait for an hour before we start tumescent liposuction, then more like 80% of the fluid that is aspirated is fat. This makes the whole process much more efficient for the patient's point of view and for the ultimate outcome of the surgical procedure. This process of detumescence doesn't work efficiently in a setting where a surgeon is using general anesthesia. In other words, in those settings, the surgeon usually has the patient under general anesthesia, does the tumescent infiltration under general anesthesia, and as soon as that's completed, they're ready to start the surgical procedure. They will not wait. The surgeon will not have the patients to wait an hour for detumescence to occur. In order to overcome the problem with excessive tumescent fluid, many surgeons in this situation will infiltrate a suboptimal amount of tumescent anesthesia so that it's not truly a tumescent situation. It is sort of a super wet technique without good complete tumescence. In this situation, the vasoconstriction is suboptimal. The bleeding during surgery will be more pronounced, and the amount of local anesthesia will be suboptimal, so that it's the self-fulfilling prophecy is that the tumescence isn't sufficient, so they need general anesthesia. They're using general anesthesia, so the tumescence is insufficient, and it goes into a circle there. By using local anesthesia and detumescence, we get better tumescent local anesthesia and permits surgeries totally by local anesthesia without any narcotic analgesia, IV sedation, or general anesthesia. Thanks. If you should like some more academic information about tumescent lidocaine anesthesia, go to tumescent.org. If you'd like information about the surgical devices and tumescent infiltration equipment, go to hksurgical.com. Thanks.